Have you ever had a moment where you are sitting at a dinner table or maybe in a quiet room with family, and out of nowhere, you feel that urge to clear your throat again? And you try to do it quietly, but it just will not go away. You cough, you swallow, you drink some water, and nothing changes. Within a minute, it is right back. That thick, sticky feeling sitting at the back of your throat like something is permanently lodged there. I want to ask you something very honestly. How long has this been going on for you? Weeks? Months? Maybe even a couple of years? Because if the answer is months or longer, I need you to stay right here with me. Because what I am about to share with you today genuinely changes everything. Here's a thing that most people do not realize. That mucus in your throat, that constant need to clear your voice, it is not a throat problem. It is not a lung problem, and it is almost certainly not what your doctor told you it was the last time you visited. The real cause is hiding somewhere completely unexpected, and once I show you where it is coming from and why your body is doing this, everything is going to start making sense, and more importantly, you are going to have a real plan to actually do something about it. I am Dr. Zoey, and today we are going to talk about something that affects millions of people over 60 and yet gets misdiagnosed, misunderstood, and mistreated more than almost any other health issue I see in my practice. So please stay with me because the most important part is coming up very soon and I do not want you to miss it. Now let me start by talking about what you have probably already tried because I know you have tried things. You are not someone who just sits and suffers. You have had ginger tea, maybe honey and lemon. Perhaps you have used a steam inhaler or those little throat lozenges from the pharmacy. Some of you have gone to the doctor and been told it is allergies. Others were told it might be post-nasal drip. Some of you were even prescribed antihistamines or nasal sprays, and while they may have helped a tiny bit, that thick, stubborn mucus always comes back. Am I right? You feel like you have been fighting this battle for a long time, and nothing is truly winning. The reason nothing has worked is because every single one of those remedies is treating the symptom, not the cause. It is like mopping your kitchen floor while a pipe is slowly leaking behind the wall. You can mop forever, but until you fix the pipe, the floor is never going to stay dry, and today we are going to find that pipe. Before I go any further, I want you to do something for me. Drop a comment below and tell me how long you have been dealing with this throat mucus. I read every single comment, and I genuinely want to know your experience. You are not alone in this, and sharing helps all of us understand it better together. So let us talk about the real story here. Most people assume that if you have throat mucus, it is coming from your respiratory system, your nose, your sinuses, your lungs, and yes, sometimes it is. A cold, a genuine allergy, living somewhere with a lot of dust or pollution, all of those things can create temporary mucus. But here is what separates a temporary mucus problem from a chronic one. A cold lasts 7 to 14 days maximum. A genuine seasonal allergy gets better when the season changes, but if you have had this thick mucus, this constant throat clearing, this feeling of something stuck for more than 4 to 6 weeks, and if you have no fever, no typical cold symptoms, no obvious seasonal pattern, then you are dealing with something completely different, and what I'm about to tell you, very few people outside of a specialist's office ever get to hear this explained properly. The true culprit behind most cases of chronic throat mucus, especially in people over 60, is something called silent reflux. Now I want to be very clear here because when most people hear the word reflux, they immediately think of heartburn, that burning sensation in the chest after a big meal, and this is exactly where the confusion happens because silent reflux is completely different. In fact, some research suggests that more than half of the people who have silent reflux never feel any heartburn at all. Zero burning in the chest, none. That is why it is called silent. It sneaks up on you without the warning signs you would normally expect. Let me explain what is actually happening inside your body, and I'm going to use a very simple picture so you can really see it. Your stomach is like a storage tank full of incredibly powerful digestive acid. Between that stomach and your esophagus, which is the tube that carries food down from your throat, there is a valve, a muscular ring that opens to let food in and then closes tightly to keep the acid from escaping. Think of it like a one-way gate. Now, in many people, especially as we get older and as certain lifestyle habits accumulate over the years, that valve starts to weaken. It does not close as firmly as it should. During the day, while you are upright and gravity is on your side, you might not notice anything wrong. But here is where it gets fascinating and honestly a little alarming. When you lie down at night, gravity is no longer helping, and from that weakened valve, it is not always a big splash of acid that escapes. Sometimes what rises is more like a fine mist, an acidic vapor so light and subtle that you do not feel it. but that mist travels all the way up your esophagus and reaches a part of your body that is extremely delicate and absolutely not designed to handle any acid whatsoever: your throat, your voice box area, your larynx and pharynx. Your stomach lining has a thick protective coating that lets it handle acid every single day, but your throat has no such protection. So when that acidic vapor lands there night after night, it causes a kind of low-grade chemical irritation, a gentle but constant burn on sensitive tissue. And now here's the part that directly explains your mucus. When your throat senses that irritation, it does the most logical thing it can. It sounds an alarm and starts producing a thick protective layer of mucus to shield itself. That mucus you are struggling with every single day is not your enemy. It is your body's attempt to protect you. It is your throat building a defensive wall because it is under attack every single night while you sleep, and you do not even know it is happening. And this is why the throat clearing never fully works. You clear the mucus, but the irritation is still there, so your body just makes more. You are winning the battle but losing the war, because the real fight is not in your throat at all, it is in your digestive system. But wait, because what I am about to tell you now is something very few people ever talk about, and it explains why this problem can feel so stubborn and so frustrating to resolve. There is a protein digesting enzyme that lives in your stomach called pepsin. Its job is to break down the proteins in your food. Perfectly useful inside the stomach where it belongs, but when silent reflux happens, pepsin travels up along with that acidic mist, and it deposits itself onto the lining of your throat, and there it sits, quiet, almost like it is sleeping until something wakes it up. What wakes pepsin up? Anything acidic that you eat or drink. That morning coffee, a glass of orange juice, a tomato-based sauce, even a fizzy sparkling water. The moment something acidic touches your throat, that pepsin activates, and because there is no food protein nearby for it to break down, it starts working on the proteins in your own throat tissue instead. It is essentially causing microdamage to the very lining it is sitting on. Your body senses this, panics, and responds by producing even more mucus to try to protect the area, and the cycle goes around and around until you address the actual root cause. I have a patient, a lovely woman named Margaret. She is 67 years old and retired. She came to see me after 2 years of what she described as feeling like she had a golf ball permanently stuck at the back of her throat. She had been to 3 different doctors. One told her it was allergies, another said postnasal drip, a third suggested anxiety. She had tried antihistamines, nasal rinses, humidifiers, every tea you can imagine. Nothing touched it. When she sat across from me and described her symptoms in detail, I could see that pattern immediately. The mucus was worse in the morning. Her voice was slightly rough when she woke up. She slept flat on her back every single night, and she had a glass of orange juice every morning because she thought it was healthy. When we address the silent reflux, and I will walk you through exactly how in just a moment, within about 6 weeks, Margaret told me her throat felt clearer than it had in years. That is the power of finding the right cause. If this is making sense to you, if you are nodding along and thinking this sounds exactly like what I have been experiencing, please hit the like button right now. It genuinely helps me reach more people who need this information, and I want as many people as possible to hear this. So let us talk about what you can actually do, because understanding the cause is only half the battle. The other half is having a real practical plan that you can start today, and I want to give you that. The very first thing, and I want you to take this seriously because it is probably the single most impactful change you can make immediately, is to elevate the head end of your bed. Not your pillows, your entire upper body. When you pile up pillows under your head alone, you only bend your neck forward, which can actually make things worse. What you need is to raise the whole upper portion of your sleeping surface so your body is on a gentle incline. You can do this by placing something firm and stable under the legs at the head of your bed, blocks of wood, thick sturdy books, anything that gives you about 6 to 8 inches of height there. Some people find a specially shaped wedge pillow helpful. This one change alone, using gravity while you sleep to keep that acidic mist where it belongs, has helped many of my patients notice a significant improvement within just a few days. If you try nothing else from this video, try this tonight. The second thing I want you to consider is your sleep position. Many studies suggest that sleeping on your left side may help keep stomach contents lower and further away from that valve at the top of your stomach due to the way the stomach is shaped inside the body. If you are a right side sleeper or a back sleeper, try shifting to your left side and see if you notice a difference over the coming weeks. Now, let us talk about food and timing, because this is where so many people are unknowingly making things worse without realizing it. There is one rule I give almost every patient dealing with silent reflux, and it is this. Try not to eat anything, and I mean anything including small snacks, for at least 2 to 3 hours before you lie down for the night. Your stomach needs time to empty itself properly before you take away the advantage of gravity. A stomach that still has food in it when you lie flat is a stomach that is much more likely to allow that acidic vapor to escape upward. This simple timing change, combined with elevating your bed, can make a remarkable difference. When it comes to your evening meal specifically, lighter is truly better. Large, heavy, fatty dinners take a long time for your stomach to process. Try making your evening meal the smallest and lightest of the day. Think along the lines of lean proteins like chicken or fish, gently cooked vegetables, and moderate portions. Save the heavier, more elaborate meals for lunchtime when you have the rest of the day upright in front of you. Now, I want to share something important about certain foods and drinks that many people with this condition find seem to make their symptoms noticeably worse. These include coffee, alcohol, carbonated beverages including sparkling water, chocolate, peppermint, citrus fruits and juices, tomato-based foods, very spicy dishes, and anything deep-fried or very greasy. I want to be careful here because everyone is different and your experience may vary. But if you are willing to try and experiment, some people find it very helpful to significantly reduce or temporarily eliminate these items for 3 to 4 weeks and observe whether their throat mucus improves. Think of it like a personal investigation. You are gathering information about your own body. Here is a tip that surprises many people. Peppermint, despite feeling soothing, may actually relax that protective valve in your stomach, potentially making reflux worse. So, peppermint tea, peppermint candies, mint-flavored gum may not be helping you the way you think. On the other hand, chamomile tea without any mint added is something many people find genuinely calming and soothing for the throat area. Ginger tea made with fresh ginger root, not the sugary commercial versions, is another option that some people find helpful for supporting digestion. These are not miracle cures, but as part of a broader approach, they may offer some comfort. Here is a little technique that can help neutralize the acid environment in your throat, particularly useful first thing in the morning when your throat has just spent the night being exposed to that acidic mist. Take a small amount of baking soda, about 1/4 to 1/2 teaspoon, dissolve it in a glass of warm water, and use it as a gargle for about 30 seconds. Do not swallow it. The alkaline nature of the baking soda can help to temporarily counteract the acidic environment in the throat and may help deactivate some of that pepsin we talked about earlier. Many of my patients have found this to be a surprisingly effective part of their morning routine. When it comes to hydration throughout the day, staying well hydrated is genuinely important because it helps keep mucus thinner and easier to manage. However, a pro tip here is to sip water steadily throughout the day between your meals rather than drinking large amounts all at once with your food. Flooding your stomach during a meal can cause it to expand and put additional pressure on that valve. There is one more thing I want to touch on that often gets overlooked completely, and that is stress. I know it sounds disconnected from a throat problem, but some research suggests that chronic stress and anxiety can increase the amount of acid your stomach produces and also affect the function of that protective valve. Finding ways to genuinely bring your stress levels down is not just good for your mind. It may be directly helping your throat too, whether that is a daily walk, gentle breathing exercises, time with people you love, prayer, meditation, or simply a quiet activity that brings you joy. Prioritize it. Think of it as part of your treatment plan. A word of caution that I feel is very important to share. Please do not simply stop taking any medication your doctor has prescribed for you based on anything you hear in this video or anywhere else online. If your doctor has given you medication and you have questions about it, the right step is to go back to your doctor and have that conversation. What I am sharing today is educational information designed to complement professional medical care, not to replace it. And I also want to be honest with you, silent reflux in its more persistent forms sometimes does need professional evaluation and treatment. If you apply these lifestyle strategies consistently for several weeks and are not noticing any meaningful improvement, please do make an appointment with your doctor and discuss the possibility of silent reflux specifically. There are tests that can help identify it and your doctor can guide you from there. Let me bring everything together for you because I know that was a lot of valuable information and I want to make sure you leave here with a clear picture of what to do. The core message is this: that chronic sticky mucus in your throat is most likely your body's protective response to ongoing irritation from silent reflux, acidic vapor, and a digestive enzyme called pepsin reaching your throat night after night. The path forward is not about treating the mucus itself, it is about reducing that underlying reflux and giving your throat the environment it needs to heal. Start tonight with the simplest and most powerful change. Elevate the head of your bed and have your last meal or snack at least 3 hours before you lie down. From tomorrow, begin paying attention to which foods and drinks seem to trigger or worsen your symptoms and consider reducing them. Add in the morning baking soda gargle, sip water steadily throughout the day, and be patient with yourself. Real healing takes consistent effort over weeks, not days. But when the cause is finally being addressed instead of just the symptom, many people begin to notice that their throat starts to feel meaningfully clearer, and that exhausting cycle of constant throat clearing begins to ease. You have been dealing with this for a long time, and you deserve real answers and a real plan. I genuinely believe that understanding what is actually happening in your body is the most empowering thing I can give you, and you now have that understanding. I would love to hear from you. Tell me in the comments, does this match what you have been experiencing? Have you ever been told about silent reflux before today? Your story might be exactly what another person reading the comments needs to hear to feel less alone. And remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health. If you found this video helpful, don't forget to subscribe to the channel and hit the notification bell so you never miss a health tip. See you in the next video.